the county governments. But we have therefore called you here this evening to update you on the corona situation in the country, but also our level of preparedness. But as a people, I wish to state that our preparedness is at the highest level possible. However, we cannot get to 100% preparedness if we do not involve the local people. And therefore, to get there, every Kenyan must be involved in as far as prevention is concerned. The basic measures that we must be able to undertake, this is a high time that we must be able to adopt the highest level of hygiene practice so that we can be able to contribute at individual level the national state of preparedness. And therefore, this evening, to give us a detailed update, I would like to invite the Chief Administrative Secretary in the Ministry of Health, Dr.Mwangangi, to give us the update. Dr. Mwangangi, please. Once she's done, you'll get an opportunity to ask questions, but please stick to the scope of this briefing. Thank you. Dr. Mwangangi.
Thank you. Thank you, Government Spokesman. Good afternoon, members of the press present here today. I'll be giving an update on coronavirus disease 2019, COVID-19. Following the confirmation of a case of COVID-19 in the country yesterday, the ministry wishes to update members of the public as follows. 1. So far, we only have one confirmed case. The patient continues to receive care and treatment at Kenyatta National Hospital Infectious Disease Unit in a self-contained room. The patient is in stable condition with normal vital signs, is cheerful and vibrant. We thank her for taking prompt action and seeking prompt health advice, and we wish other Kenyans who may be symptomatic will follow her example. The Ministry of Health has traced 22 close contacts who have been quarantined at KNH isolation units at Mbagathi. Specimens from these contacts are currently undergoing testing at KEMRI laboratories. 4. 23 other persons of mixed nationalities who traveled on the same flight with the patient have also been traced and advised to undertake self-quarantine for 14 days. The ministry's rapid response team is following them up on a daily basis until the 14 days are over. 5. The county team, in conjunction with the Ministry of Health, has fumigated the apartment block where the patient was resident. 6. We have set up 2 counseling centers, one in KNH and another in Mbagathi, and we have deployed counselors who are now taking care and meeting the needs of the quarantine patients and their families. 7. The Public Health Operation Center has been fully activated to coordinate response efforts. A call center has been set up to enhance communication on COVID-19. Members of the public can reach the call center by dialing 719. I repeat, by dialing 719 for audio messages and *719# for short messages. This will apply across all networks. The Ministry of Health, in partnership with county governments, the Kenya Red Cross, AMREF, WHO, the World Bank Group, KEPSA, University of Nairobi, and Kenya Health Federation, amongst other stakeholders, are now going to initiate community engagement, and AMREF shall take lead in mobilizing community health strategy in order to raise awareness across the country. On Monday, additionally, the business community will come together and will share a compact on how they will contribute to the intervention against COVID-19. The ministry continues to maintain heightened surveillance at all points of entry, health facilities, and communities across the country. We urge members of the public to remain vigilant and are advised to continue taking the following precautionary measures as advised. 1, maintain basic hand hygiene and safe food practices. And basic hand hygiene, we emphasize, begins with simple hand washing. Avoid close contact with people who are coughing or who have flu-like symptoms. In addition, anyone showing symptoms of chest infection illness, such as fever, coughing, difficulty in breathing, sneezing, and with a history of travel, is strongly advised to go to the nearest health facility for assessment and prompt management. In addition, anyone with recent history of travel is strongly advised to self-quarantine for 14 days and promptly report to the nearest health facility in case they develop any of the above symptoms. Additionally, we have taken note of videos doing rounds on social media with fake information, which is aimed at misinforming and causing unnecessary panic to the public. We wish to inform the public not to consume information that has not come from official government communication channels. And these are at MOH Kenya and at spokesperson GOK. The fake and alarming videos have been forwarded to the DCI for investigations, arrest, and prosecution of such individuals. As I conclude, I would like to assure the public that the government is doing everything possible to manage this situation, and I therefore urge everyone not to panic and to continue to observe preventive measures as outlined by the Ministry of Health. Thank you.
Thank you so much, Madam CS. Now you have the opportunity to ask a few questions, and please stick to the scope of today's briefing.
Gloria Medina from A24 TV. You think that you faced 22 other people who traveled where are they? So they say that they are self-quarantined. Where are these people? And then today we saw the fumigation in Rongai also involved a bus that she allegedly used. You know, public service people who want to get the money back. So what are you doing in terms of trying to assure residents of Rongai probably absolute safety and yeah.
You want to ask us?
More questions.
More. Okay, two more.
My name is Mel Mieto from NTV, and it's more on what my colleague is asking. It's 22 close relatives that we say, or close contacts that have been identified, and then 23 others. So in total, that's about maybe give or take 85. So we just need to know the health status of these. After 22 and then the 23, if you could just make that know.
Another one more before. Yes. Okay.
Of the 22 that are now in isolation at Bagati, have you taken samples from them, or are they just there for observation for 14 days as you wait to see whether the symptoms will manifest?
Yeah. Thank you for those questions. I'll begin with the last question. Indeed, of the 22 that are in quarantine, we are taking samples and we're in the process of running those samples. And immediately we get the results, we shall then communicate this with the families first, the individuals, and then of course with the public. And the second question, you've mentioned that there are other 23 close contacts who are in the flight that were with this patient. We've notified the different persons. These persons consist of different nationalities who all had different destinations, but we've been able to get the manifests and have communicated with them and have given the proper protocols of how self-quarantine will be done. These people are not within the country. Concerning the fumigation that was taking place, indeed, we are advocating for interventions that deal with prevention and hand washing and hygiene. And the fumigation process that took place, we have confidence we'll be able to ensure safety. Regarding public transport, this will be escalated to the National Emergency Response Committee, and this committee, following the executive order, will be giving further instructions in the coming week on Monday on how we shall engage in that space. Is there any other question?
Any other?
The test done?
My name is Edward Tabasi from KBC. I have two questions. What is being done to ensure that the medical staff who are handling these patients are well taken care of? Because one of the issues that we did see in China, although a lot of infections which took placed on the side of the medical staff? And question number two, we appreciate the fact that you are giving us updates on this matter, but as a media, we feel that we are not being given the opportunity to interrogate further in terms of the checks that are being, that are taking place at the points of entry, like the JKIA, Namanga, and even Malaba. What is the ministry doing to ensure that we get better access to these places so that we can inform the country on this kind of steps that the government is taking to ensure that the virus is not spreading in the country?
I think I'll take that question now. So indeed, as witnessed in China, our health workers are our frontline heroes. And in this situation, the government has come in strongly and provided protective clothing. And this clothing will be utilized by these health workers. We shall have continued capacity engagements with the health workers, training them how to use this equipment, training them how to be able to manage themselves when they're taking care of any possible patient, and most importantly, also providing counseling services for frontline health workers who are engaging with these patients. With regard to engagement with the media, we must say that we do appreciate the media. The media are actually our front runners in ensuring that the health promotion messages are passed on to the communities, and we shall engage with you. We shall be able to organize and see how we can have you participate and see what is happening at the points of entry. And we do appreciate your support through this.
So the last two. Okay, I can see there are none, right? So just to finish, we are going to give you daily updates, and we shall be able to review that as time goes. Thank you. What I was saying is that we are going to give you daily updates on this situation, but remember again, this is a very, very fast-moving situation, and we therefore will be able to review that as time goes by. So tomorrow we are also going to have another update like this one. We'll give you the timing and the location, and again on Mondays. We'll go on like that until we review, based on the situation as it develops. So thank you very much, members of the press.